what advice do you give, or what conversations do you have with expectant mothers who are living with HIV about breastfeeding?
I think you've hit the nail on the head. It's about having a conversation, supporting a woman's decision and recognising that women will do what's best for them and for their families if they're armed with the right information. So you're right, U equals U, undetectable equals untransmissible, only applies to sexual transmission. It does not apply to breastfeeding. So in the studies that have been done, even in the context of being on antiretroviral therapy, there are a few transmissions through breastfeeding. So the risk is probably between 1% to 3%, which is low. So without treatment, you're looking at 25%. I think you have to have an open conversation with women and let them make that decision. So you say, look, if you take treatment and you adhere to treatment, your risk of transmission to the baby is very low. It's between 1% to 3%, but it's not zero. The only way of avoiding transmission completely is through formula feeding, and then start the ball rolling. And a woman may decide that there are all sorts of other beneficial impacts of breastfeeding. There's a whole host of really good things that happen through breastfeeding, including bonding with your child and just personal enjoyment. And so if a woman really feels that that's the right decision for her and her baby, then it's up to us to help her minimize those risks of transmission and give her that advice. And that study you were talking about, Nourish UK, which I'll put a link on in my Twitter afterwards, is the first study in years to be done in the UK looking at how women make these decisions about infant feeding. And so they'll be producing loads of amazing videos that women can access as sort of information and support resources.
Wonderful. I mean, I'm very conscious that many of our viewers are living in other parts of the world where the guidance might be significantly different. What would you say, Shema, in relation to that?
I mean, that, Susan, really points to the complexity of infant feeding, and no wonder women find this so confusing. So we know in countries where there isn't access to safe and affordable infant formula feed, so there might not be good enough access to water, there might not be consistent access to formula feed. In that case, it is safer to breastfeed because the risk of a child not having adequate nutrition or being fed with contaminated water is much greater than the risk of, even if they acquire HIV, the risk of actually living with HIV. So it does depend on where you are, and that really highlights the sort of inequalities around the world still that exist when it comes to living with HIV.